Hi everyone, thank you for joining us today. My name is Keith Bussey. I'm here with my colleague Dewana Calhoun, and we work on behalf of the Georgia Department of Public Health. Today we're going to cover webinar 4 of the Georgia cAARds program webinar series. The title of today's webinar is Quality Improvement Examples. Let's begin. I'm going to talk about a brief overview of what this webinar entails. We're going to do a recap of the Georgia Tobacco Quit Line. We're also going to do a recap of the Georgia cAARds program. We're going to provide a brief overview of what this webinar entails, continuous quality improvement cycle. Dewana, my colleague, will cover that. And then we're going to wrap up with next steps from this webinar moving forward. Now let's talk about the Georgia Tobacco Quit Line recap. The Georgia Tobacco Quit Line. What is a quit line? A quit line is a telephone-based tobacco cessation service that's available to any resident in any state throughout America, including Washington, D.C. and Puerto Rico. The services are provided free of charge to all residents that call the quit line. Anyone can call the quit line. It doesn't have to be a tobacco user. For instance, anyone that smokes cigarettes or use snus or dip. It can also be a relative, a friend, or a healthcare provider of the tobacco user calling to get more help with helping their relative or friend make a quit attempt. Now let's talk about the caller experience. When a caller or a patient calls the Georgia Tobacco Quit Line, what happens, she or he is connected to a registration intake specialist. That specialist helps the person with determining their level of motivation, takes basic information, explains the services that are offered by the Georgia Tobacco Quit Line, and if he or she, the caller or the patient, is ready to make a quit attempt, they're connected with a quit coach. It's a live transfer. Otherwise, if the caller or patient is not ready, the registration intake specialist provides encouragement for the caller or patient to try calling back at a later time. The Georgia Tobacco Quit Line assessment and planning call. Once a caller or patient is connected with a quit coach, he or she spends about 25 minutes taking a tobacco use history, talking about previous quit attempts, why they didn't work, what were some barriers, what caused relapse, determines the self-efficacy of the caller. The quit coach does this, and they move forward with creating a quit plan. This quit plan is tailored to each caller and each patient. And in the quit plan, there's information about nicotine replacement therapies. The Georgia Tobacco Quit Line offers a 4-week supply of patches and gum while supplies last. Also in the quit plan, there's information that encourages the caller or patient to make mini quits. Quitting takes practice and different people go at different paces, so some people need a little bit more help and a little bit more time than others, and this plan speaks to that. There are 4 coaching calls that are provided to each patient or caller. The first call is scheduled around the planned quit date, which the caller works with the quit coach to determine. Then there's another call that occurs about a week or so after the planned quit date. And then 2 to 3 additional calls are scheduled in accordance to availability and the process along the quit continuum, if you would. So from patient to caller, the second and third calls, they vary. What is discussed during those calls with the quit coach and the caller includes any successes that may have occurred, reinforcing those, talking through any barriers or any relapses that may have occurred, and just general information that's shared throughout the entire process is sort of reiterated and they build on that. The Georgia Tobacco Quit Line provider services. When a caller or patient decides to enroll in the Quit Line services, a patient's outcomes report is generated. This report has information for the patient and the healthcare provider. It captures the healthcare provider's institutional information, the patient's contact information. It talks about the status at the point that the report was generated, such as whether or not the caller decided to accept services, whether or not they declined services, whether or not they decided to have tobacco cessation counseling services, only or in conjunction with nicotine replacement therapies. Also, the report captures how many times the quit line tried to reach out to the caller. Once this information is made available, it's faxed directly to the healthcare provider. With that brief recap of the Georgia Tobacco Quit Line, I would like to hand this over to my colleague Dewana Calhoun. And remember, if you want more extensive information about the Georgia Tobacco Quit Line, please view our first webinar in the Georgia cAARds program webinar series. Now I'm going to hand it over to Dewana.
Thanks, Keith, for that introduction, and we're so delighted that you, as well as members of your team, have joined us today. By the end of this presentation, we hope that healthcare professionals, public health professionals, as well as employee health professionals attain the skills, information, resources, and knowledge necessary to continue to implement evidence-based tobacco cessation interventions. This webinar series, as a friendly reminder, will be posted on the Georgia Department of Public Health's website. So let's learn more about the Georgia cAARds program. The history of the Georgia cAARds program is based on California's Do You Card campaign, which is a collaboration between two California Department of Public Health state programs, the California Tobacco Control Program, as well as the California Diabetes Program, with assistance from the California Smokers Helpline and supported by the CDC's Office of Smoking and Health. Their major partners include California's Medical Association Foundation, the American Association of Diabetes Educators, as well as the California chapters of the American Association of Clinical Endocrinologists. So in similar fashion, the Georgia cAARds program, or Ask, Advise, and Refer with Follow-Up program, is a multifaceted educational program and is also the result of a collaboration between two state programs, the Georgia Tobacco Use Prevention Program, as well as the Georgia Diabetes Prevention and Control Program. The Georgia cAARds program, as a friendly reminder, is designed to further support healthcare providers, mid-level practitioners, and other members of the clinical support team, as well as public health professionals, with improving the delivery of services provided to all tobacco users, including members of vulnerable population groups, such as pregnant and postpartum women. In addition to providing support to address Healthy People 2020 national objectives, in order to improve the overall health status among tobacco users, the Georgia cAARds program is designed to align with additional national standards and measures. So for example, the content that's featured in the Georgia cAARds program reference manual also supports the tobacco measurement set. So for example, healthcare providers who are currently addressing Joint Commission measures related to tobacco use may find the content featured in the Georgia cAARds program reference manual beneficial to all members of their team. The Georgia cAARds program is ideal to be implemented in various settings, including physician offices, hospitals, federally qualified health centers, local health departments, urgent care centers, as well as other healthcare and public health settings. The content that's featured in the Georgia cAARds program reference manual was also designed to strengthen coordination of care efforts. The content that's featured as part of the Georgia cAARds program is also designed to support patients in various cities, towns, and regions. So why is this so important to us? Because in some cities, towns, and regions throughout Georgia, the same patient may be seen in one setting and then referred to another setting for additional or more comprehensive care, treatment, or services. So the Georgia cAARds program is designed so regardless of the setting, healthcare providers and members of their support team are exposed to the same resources and information at the same time and are able to utilize case studies from other locations as a reference to either meet or exceed national standards related to tobacco cessation. The Georgia cAARds program was so important to us in Georgia because approximately 1/2 of adult tobacco users have attempted to quit in the past year. So your commitment to supporting tobacco cessation interventions by taking a few additional steps when providing services to adult tobacco users is so important, as smokers cite a healthcare provider as an important motivator to quitting tobacco. The Georgia cAARds program is designed to align with several national goals. One example of a Healthy People 2020 national objective related to tobacco use cessation is Healthy People 2020 Maternal, Infant, and Child Health Objective 18, reduce postpartum relapse among women who quit smoking during pregnancy. So let's get started by providing everyone with a brief overview of a continuous quality improvement model that organizations can adopt. The Plan, Do, Study, Act model is an example of one continuous quality improvement model that organizations may choose to implement to support their tobacco cessation efforts. As a friendly reminder, organizations are encouraged to start small. Small changes that are applied consistently can make a big difference. Organizations are encouraged to utilize the tobacco intervention record sample that's featured in the supplemental packet that's featured on the Georgia Department of Public Health website. It's also featured in the Georgia cAARds Program Reference Manual. And organizations are encouraged to keep in mind what processes may impact a tobacco user once he or she enters your practice or your facility. A few steps that organizations may adopt as part of the quality improvement planning processes include developing or revising existing process or office workflow charts, developing draft protocol or policies, as well as finalizing protocols or policies. The good news is that helpful templates or samples are featured in the Georgia cAARds Program Reference Manual, and they are designed to assist or support organizations throughout each phase of the planning and implementation process. Organizations may also incorporate suggested content from the templates that are featured in the Georgia cAARds Program Reference Manual into their electronic medical record system. Ideal sections include the registration section, screening section, as well as a comprehensive assessment sections. Additional ideal sections where organizations may make changes include the plan of care, referral and coordination of care sections. Organizations are also encouraged to incorporate prompts or gentle reminders to capture missed opportunities or missed entries, but also to remind staff about taking the next steps needed. Organizations may also decide to perform some type of medical review. The medical review process may vary by organizations. Some organizations may select to conduct a random chart review, while all other organizations may elect to perform a quarterly review or a monthly review. So conducting documentation and workflow process reviews each month and then on a quarterly basis may be ideal for some organizations. But organizations are also encouraged to discuss any major or commonly occurring changes during their weekly or bi-weekly team meetings in an effort to resolve any challenges early and to make timely adjustments to evaluate their processes for efficiency and effectiveness and amend policies and procedures accordingly or as soon as possible. When performing a monthly or a quarterly medical record review, organizations may decide to review the documentation to ensure that it aligns with current policy and guidelines. It's so important for organizations to also view the evidence to make sure that the documentation demonstrates who documented the information, when the information was documented, and what follow-up actions were conducted. And the referral process is also so important for organizations to track how effective the services that occurred are the end result. So when referring patients, organizations are encouraged to capture all tobacco users in a query form or some type of report form, and also compare this information or this data against all tobacco users who were referred for some type of service. Organizations may also consider documenting so that the information not only address when the required information was received by a healthcare provider or referring provider, but also what follow-up steps were actually recommended and implemented. So the Georgia cAARds program includes additional resources that are available to all healthcare providers and public health professionals to guide them through these processes. So as a friendly reminder, Georgia cAARds program participants receive not only free Georgia cAARds program resources, including the Georgia cAARds Program Reference Manual, but they also receive free patient education materials as well as provider information as well. Organizations are encouraged to contact me or my colleague Keith Bussey at the Georgia Department of Public Health. Organizations are also encouraged to visit the Georgia Department of Public Health website. The benefits about becoming a Georgia cAARds program participant is that participants not only receive free resources, including the Georgia cAARds Program Reference Manual, but they also receive additional patient educational resources as well, which includes the Georgia Tobacco Quitline brochure, which is offered or available in 4 versions as well.
Thanks, Dewana. Now I want to direct everyone's attention to the Department of Public Health website. So if you would, pull up your browser and type in the website address, which is dph.georgia.gov. That's Georgia spelled out, dph.georgia.gov. And I'll walk with you through the process of getting to the Georgia cAARds program website so you can download and have access to the materials that Dewana covered in her portion of the webinar. So once you bring up your browser and type in the website address, it'll bring you to the home page of the Georgia Department of Public Health. What you would do is click Programs. Once you click Programs, you would select Health Promotion. Once that page loads, I want you to direct your attention to the left side of the screen where it has Health Promotion and Disease Prevention section. Click that link. Once that page loads, I want you to scroll down, continue to focus on the left side of the screen, and select Tobacco Use Prevention Program. Once that page loads, I want you to once again scroll down, focusing on the left side of the screen, and select Georgia cAARds Program Ask, Advise, Refer with Follow-Up. Once you click that link, it'll bring you to the Georgia cAARds Program website, where you can find more information about the program. You can see a YouTube clip of a healthcare provider talking about his experience with implementing the program comparable to Georgia cAARds, as well as at the bottom of the page, a section entitled Related Files. In this section, you will find PDFs of the information that Dewana covered in the webinar. This is free of charge to you. You can download and print as many as you like. Also, if you have more questions or if you want to request more materials, such as the abbreviated version of the reference manual or the comprehensive version, do not hesitate to reach out to me. My contact information is here. You can shoot me an email. You can give me a call. I look forward to hearing from you. This concludes webinar 4 of the Georgia cAARds Program webinar series. Please stay tuned for additional webinars that are coming in the near future. Thank you.